this is going to be a turn toward greatness. Leadership is something that we're all very capable of as human beings, and it is extraordinarily important in environments like education and healthcare because we're connecting to other human beings, we're developing other human beings, we're committed to other human beings and their wellness, and frankly, their wellness in life, period. It's really important for us to recognize that each one of us has a tremendous responsibility in leadership to help us make it through change, but more importantly, to thrive in that change. Ultimately, what's most important at the center of this organization is the patient and the student, and without question, we all have to be certain that we are good to each other as well. Because when we are good to each other, we have honest relationships, we care for each other, even with all of our differences that we have. One of the things that really separates organizations is a culture of focus on what we want to see happen and what we know we can do versus a culture that's focused on fears and what we don't want to see happen. And if we focus on controlling our thoughts in positive ways that enable us to concentrate on what we want to see happen, it'll happen. Without question, the most important thing to me at this institution is safety. You know, we can focus on all of the things that we need to see in the long term, but now, today, every day, going forward, we have to be committed to being the safest hospital in the United States of America. We must and we will. We are modeling all of this for our students, and we want to be certain that when our students leave here, every place that hires them says they know safety. And they're committed to patients and making certain that they're safe. They're committed to their colleagues and their safety. I'm asking you to think about everybody you care for as a special human being. When I see any patient, I think of every patient as if they were my relative. I have no insensitivity about when something happens to them that shouldn't have happened to them. It hurts me deeply, and the way to avoid that hurt is to be certain that we are taking care of that patient in the best possible ways in every aspect of their experience, making certain that they are completely protected and that their safety comes first. We will do this. This is going to happen. We will bring everybody together around a focus on safety, a focus on the patient experience, on the patient's service experience, and we're going to treat each other as respectfully and professionally as everyone should be treated. On a per-patient basis, we have a lot of resources. The question may be whether or not they're in the right places. And as times change, and as you become more focused on what matters, which is that patient's experience and their safety, and the quality of what we're doing for them wrapped up into that experience, I guarantee you'll find the resources and you will shift them toward what counts and what matters the most. This place deserves it. Every one of those patients deserve it. Our students deserve it. And all of the great people who work at VCU deserve it. We are at a great place in time. Yes, the headwinds are difficult with healthcare changes, but they will always be that way. I guarantee you that when you look back at your career, if it was at VCU, you'll be so glad with the number of lives that you've touched, the number of people who you've healed, the number of people who you transformed. That's the VCU story.